Hello learners, welcome to the certificate course on Orthopedic Nutrition and Health. The course will be led by the instructor Brinda Rajkumari. So here we will be looking into the course modules. In each module, we'll be discussing different topics. I hope it will be very interesting to you. And here we'll be starting from the scratch that we'll be knowing the entire physiology of bone, and then we will be moving into the nutrition part. So in first, we'll be dealing with the 12 modules. The 12 modules in the course includes structure and physiology of bone, types of bone cells and action of hormones on bones, calcium metabolism, regulation of bone blood calcium levels, factors affecting bone health, common biomarkers of bone health and assessment in children, osteopenia and osteoporosis, nutrition and bone health, other components in nutrition and special needs for seniors, other bone health related diseases, physical activity and bone health, and the final module will be case study discussion. In first module, we'll be discussing on structure and physiology of bone. Here, we'll be introducing the entire course, and then we'll be moving into the functions of bones, classification of bone, parts of bone, the composition of bone, which includes matrix and bone salts, and the structure of bone. In module 2, types of bone cells and action of hormones on bones. And here we'll be dealing with types of cells in bone that includes osteoblast, osteocytes, and osteoclast. And then we'll be looking the role of each hormones on bones, which includes the action of bone, that is growth hormone on bones, action of parent hormone on bones, and the action of calcitonin in bones. In module 3, we'll be dealing with calcium metabolism, importance of calcium, normal value, types of calcium, that is the calcium present in plasma and the calcium present in bones, the sources of calcium that includes both from dietary source and from bones, daily requirements of calcium, absorption and excretion of calcium that includes that is dealt separately, the absorption of calcium from gastrointestinal tract and how it is excreted from the body. In module 4, the regulation of blood calcium levels will be discussed. That we'll be discussing in detail with each hormone's role in maintaining the blood calcium levels. That also includes the effect of other hormones. In module 5, we'll be discussing on the factors affecting bone health. It includes nutrition, exercise and lifestyle, and the body weight and composition. In module 6, the common biomarkers of bone health and the assessment in children will be discussed, in which the common biomarkers of bone health includes urinary calcium, hydroxyproline, acid phosphatase, total alkaline phosphatase, osteocalcin, hydroxylysine, deoxypyridinoline, and the assessment of bone health in a growing child or adolescent includes the assessment of bone health in children and how and what affects the bone mass in children. In module 7, the osteopenia and osteoporosis will be discussing in this module. Osteopenia and osteoporosis will be giving a short introduction for these two. And the prevalence and the types of osteoporosis, the risk factors for developing osteoporosis, prevention of osteoporosis and fractures, and the prevention strategies with the help of exercise and diet will be discussed. The treatment of osteoporosis, in which the medical nutrition therapy and the role of exercise will be discussed. In module 8, the nutrition and bone health, energy, protein, minerals, especially calcium, phosphate, and trace minerals. In vitamins, vitamin A, D, K will be discussed. In module 9, the other components in nutrition and special needs for seniors. The other dietary components which have the role in the bone health will be discussed, and the others include high acid or alkaline diets, including sodium and vegetarian diets, and the special needs, nutritional needs for seniors that we'll be discussing with specific to the malnutrition and bones in the elderly, calcium and vitamin D for bone health in the elderly, and the dietary protein and bone health in the elderly. In module 10, the other bone health related diseases will be discussed. That includes gout, osteoarthritis, rheumatoid arthritis, rickets and osteomalacia, and the glucocorticoid induced osteoporosis. In module 11, we'll be discussing the role of physical activity in bone health, which includes the influence of physical activity on bone health and the exercise for bone health. That includes why is exercise necessary for bone health, best exercises for bone health, and some of the exercise tips. And in module 12, the case study discussion, we'll be having a small discussion about a case. So from which you can able to know how nutrition is playing a very important part in managing or preventing the other bone health related diseases. So here we'll be having a case study. So we'll have the other parameters, how the patient is experiencing, and that includes the anthropometrics, physical exam, the laboratory results, the nutrition history, the usual diet of the case, the questions to be answered to set the goals, and the goals and the intervention, and what all to monitor or evaluate to reach those goals, and we'll be concluding the entire course. So hope if you have a good idea of the course contents of this orthopedic nutrition course, and we'll be meeting again during the course session. Thank you.